Hello everyone, now let us discuss about anatomy of endocrine glands part 3. In the current session we will be focusing on thyroid. The butterfly shaped thyroid gland is located just inferior to larynx, that is voice box. It is composed of right and left lateral lobes, one on either side of the trachea, that are connected by an isthmus. Isthmus is nothing but a narrow passage anterior to trachea. About 50% of the thyroid glands have a small third lobe called as pyramidal lobe, and it extends superiorly from the isthmus. The normal mass of thyroid gland is about 30 grams, and the microscopic spear sacs called thyroid follicles, they make up most of the thyroid gland. The microscopic spherical sacs called thyroid follicles, they make up most of the thyroid gland. The wall of each follicle consists primarily of cells called as follicular cells, most of which extend to the lumen, internal space of the follicle. And the basement membrane surrounds each follicle. When the follicular cells are inactive, their shape is low cuboidal to squamosal. But under the influence of thyroid stimulating hormone, they become active in secretion and range from cuboidal to low columnar in shape. The follicular cells produce two hormones, thyroxine, which is also called as tetraiodothyronine, thyroxine, which is also called as tetraiodothyronine T4, because it contains 4 atoms of iodine, as in the name tetraiodothyronine. The next is triiodothyronine, T3. T4 is tetraiodothyronine and T3 is triiodothyronine, which contains 3 atoms of iodine. So follicular cells produce two hormones, T4 and T3. Now here you can see the schematic representation of thyroid gland. The pink colored one is the thyroid gland. This one. It has right lateral lobe and left lateral lobe, and this is the isthmus. And here you can see the blood supply and the nerve supply also for the thyroid gland. This one is the hyoid bone. The red color one is the superior thyroid artery, and the blue color one is the superior thyroid vein. And this one is the thyroid cartilage of larynx. And this one is the left lateral lobe of thyroid gland, and this one is the right lateral lobe of thyroid gland. And this small one is the pyramidal lobe of thyroid gland, third lobe. And this one is the isthmus of the thyroid gland. T3 and T4 together are known as thyroid hormones. A few cells called parafollicular cells or C cells lie between the follicles. They produce the hormone calcitonin, which helps to regulate the calcium homeostasis. In addition to thyroid hormones, a few cells called as parafollicular cells or C cells, they lie between the follicles. They produce the hormone calcitonin, which helps in the regulation of calcium homeostasis. And in general, the thyroid hormones regulate oxygen use and basal metabolic rate, cellular metabolism, growth and development. Now coming to the formation, storage and release of thyroid hormones. The thyroid gland is the only endocrine gland that stores its secretory product in large quantities. And coming to the synthesis and secretion of T3 and T4, it occurs in following manner. The first one is iodine trapping. The thyroid follicular cells trap iodine ions by actively transporting them from blood into the cytosol. As a result, the thyroid gland normally contains most of the iodine in the body. Because of this reason, the thyroid gland normally contains most of the iodine in the body. The next is synthesis of thyroglobulin. While the follicular cells are trapping iodine, they are also synthesizing thyroglobulin, TGB, a large glycoprotein that is produced in the rough endoplasmic reticulum, modified in the Golgi complex and packed into secretory vesicles. The vesicles then undergo exocytosis, which release the thyroglobulin into the lumen of the follicle. The first step is thyroid trapping. The next is synthesis of thyroglobulin. globulin. The third step is oxidation of iodine. Some of the amino acids in the TGB are tyrosines that will become iodinated. However, negatively charged iodine ions cannot bind to tyrosine until they undergo oxidation, that is removal of electrons to iodine. As the iodide ions are being oxidized, they pass through the membrane into the lumen of the follicle. Next step is, the third step is oxidation of iodide. Because the charged iodide ions cannot bind to tyrosine until they undergo oxidation, these iodide ions, they undergo oxidation and form iodine. And once the iodine is formed, it passes through the membrane into the lumen of the follicle. The next step is iodination of tyrosine. As iodine molecules form, they react with tyrosines that are part of thyroglobulin molecules. Binding one of the iodine atom yields monoiodotyrosine T1, and the second iodination produces diiodotyrosine T2. The TGB with attached iodine molecules, a sticky material that accumulates and is stored in the lumen of the thyroid follicle, is termed as colloid. The next step is coupling of T1 and T2. During the last step in the synthesis of thyroid hormone, two T2 molecules join to form T4, or one T1 and one T2 join to form T3. That is the coupling of T1 and T2. In order to form T4 molecule or T4 hormone, two T2 molecules join. And in order to form T3, one T1 and one T2 join to form T3. The next step is pinocytosis and digestion of colloid. Droplets of colloid re-enter follicular cells by pinocytosis and merge with lysozymes. The digestive enzymes in the lysozyme break down TGB, cleaving off molecules of T3 and T4. And finally, secretion of thyroid hormones. Because T3 and T4 are lipid soluble, they diffuse through the plasma membrane into the interstitial fluid and then into the blood. T4 normally is secreted in greater quantity than T3, but T3 is several times more potent. However, after T4 enters a body cell, most of it is converted to T3 by the removal of one iodine. Finally, transport in the blood. Step 8. More than 99% of both T3 and T4 combined with transport proteins in the blood, mainly thyroxine binding globules, TGB. Here you can see the various steps in the synthesis and secretion of thyroid hormone. The first step is iodine trapping. The next step is synthesis of TGB. TGB is nothing but thyroglobulin. The next third step is oxidation of iodide. These iodide molecules undergo oxidation and form iodine molecules. And this iodine reacts with tyrosine. The fourth step is iodination of thyroxine. And the fifth step is coupling of T1 and T2. And finally, next step is pinocytosis and digestion of colloid by the lysozymal enzymes. Then the release of T3 and T4. And finally, next step is secretion of thyroid hormones, that is T3 and T4. The eighth step is transport in the blood. It is done mainly by thyroxine binding globulin, TBG. This is done by TBG. This is the overall steps in the synthesis and secretion of thyroid hormones. Now coming to the actions of thyroid hormones. Because most of the body cells, they have receptors for thyroid hormones T3 and T4, they exert their effects throughout the body. The first action is thyroid hormones increase basal metabolic rate, BMR, the rate of oxygen consumption under standard or basal conditions, that is awake, at rest and fasting. Thyroid hormones increase basal metabolic rate BMR by stimulating the use of cellular oxygen to produce ATP. When the basal metabolic rate increases, cellular metabolism of carbohydrates, lipids and proteins increases. The second major effect of thyroid hormones is to stimulate the synthesis of additional sodium potassium ATPase pump, which uses large amounts of ATP to continuously eject sodium ions from the cytosol into the extracellular fluid and potassium ions from the extracellular fluid into the cytosol. As the cells produce and use more ATP, more heat is given off and body temperature rises. This phenomena is called as calorigenic effect. And in this way, the thyroid hormones play an important role in the maintenance of normal body temperature. And normal mammals can survive in freezing temperatures, but those whose thyroid glands have been removed cannot. The next action is regulation of metabolism. The thyroid hormones stimulate protein synthesis and increase the use of glucose and fatty acids for ATP production. They also increase lipolysis and enhance cholesterol excretion, thus reducing blood cholesterol levels. The next action is they enhance some of the actions of catecholamines, for example, norepinephrine and epinephrine, because they upregulate the beta receptors. Thyroid hormones upregulate the beta receptors. For this reason, symptoms of hyperthyroidism include increased heart rate, more forceful heartbeats, and increased blood pressure because they upregulate the beta receptors. And finally, together with the human growth hormone and insulin, thyroid hormone accelerate body growth, particularly the growth of the nervous system, nerves and skeletal systems. Deficiency of thyroid hormone during the fetal development, infancy or childhood causes severe mental retardation and stunted bone growth. Coming to the control or regulation of thyroid hormone secretion. The thyrotrophin releasing hormone TRH from the hypothalamus and thyroid stimulating hormone TSH from the anterior pituitary stimulate the synthesis and release of thyroid hormones. TRH and TSH stimulate the release and synthesis of thyroid hormones. And low blood levels of T3 and T4 or low metabolic rate stimulate the hypothalamus to secrete TRH. TRH enters the hypophyseal portal veins and flows to the anterior pituitary where it stimulates the thyrotropes to secrete thyroid stimulating hormone. The thyroid stimulating hormone stimulates virtually all aspects of the thyroid follicular cell activity, including iodine trapping, hormone synthesis, secretion, and growth of the follicular cells. The thyroid follicular cells release T3 and T4 into the blood until the metabolic rate returns to normal. And an elevated level of T3 inhibits the release of TRH and TSH, that is nothing but negative feedback inhibition. And the conditions that increase the ATP demand, a cold environment, hypoglycemia, high altitude and pregnancy also increase the secretions of thyroid hormones. Here you can see the regulation of secretion and actions of thyroid hormones. The first step is low levels of T3 and T4 or low metabolic rate stimulate the release of TRH. Once the TRH is released from the hypothalamus, this TRH stimulates thyroid stimulating hormone and this thyroid stimulating hormone released into the bloodstream stimulates the thyroid follicular cells. And these thyroid follicular cells, they synthesize T3 and T4 is released into the blood by follicular cells. And an elevated T3 inhibits the release of TRH and TSH, thereby decreasing the release of T3 and T4. Coming to the actions of thyroid hormones, they increase the basal metabolic rate, stimulate the synthesis of sodium potassium ATPase, increase the body temperature, that is calorigenic effect, stimulate protein synthesis, increase the use of glucose and fatty acids for ATP production, stimulate lipolysis, enhance some actions of catecholamines, and regulate the development and growth of nervous tissue and bones. Coming to calcitonin, the hormone produced by the parafollicular cells of the thyroid gland is calcitonin CT. CT can decrease the levels of calcium in the blood by inhibiting the action of osteoclasts, the cells that break down the bone extracellular matrix. The secretion of CT is controlled by negative feedback system. When its blood level is high, calcitonin lowers the amount of blood calcium and phosphate by inhibiting the bone resorption, that is breakdown of bone's extracellular matrix by osteoclasts, and by accelerating the uptake of calcium and phosphates into bone extracellular matrix. Miacalcin, a calcitonin extract derived from the salmon that is 10 times more potent than the human calcitonin, is prescribed to treat osteoporosis. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.